Lower back pain. Low back pain or lumbago is a common disorder involving the muscles and bones of the back. It affects about 40% of people at some point in their lives. Low back pain may be classified by the duration as acute, pain lasting less than 6 weeks, subchronic 6 to 12 weeks, or chronic more than 12 weeks. The condition may be further classified by the underlying cause as either mechanical, non-mechanical, or referred pain. Signs and symptoms. In the common presentation of acute low back pain, pain develops after movements that involve lifting, twisting, or forward bending. The symptoms may start soon after the movements or upon waking up the following morning. The description of the symptoms may range from tenderness at a particular point to diffuse pain. It may or may not worsen with certain movements, such as raising our leg or position, such as sitting or standing. Causes. Low back pain is not a specific disease, but rather a complaint that may be caused by a large number of underlying problems of varying levels of seriousness. The majority of lower back pain does not have a clear cause, but is believed to be the result of non-serious muscular or skeletal issues such as sprains or strains. Obesity, smoking, weight gain during pregnancy, stress, poor physical condition, poor posture, and poor sleeping position may also contribute to low back pain. A full list of possible causes includes many less common conditions. Physical causes may include osteoarthritis, the degeneration of the disc between the vertebra or a spinal disc herniation, a broken vertebra, or rarely an infection or tumor of the spine. Back structures. The lumbar or lower back region is made up of 5 vertebrae, L1 to L5. In between these vertebrae are fibrocartilaginous discs, which act as cushions, preventing the vertebrae from rubbing together while at the same time protecting the spinal cord. Nerves come from and go to the spinal cord through specific openings between the vertebrae, providing the skin with sensations and massage to muscles. Stability of the spine is provided by the ligaments and muscles of the back and abdomen. Small joints called face joints limit and direct the motion of the spine. Diagnosis. As the structure of the back is complex and the reporting of pain is subjected and affected by social factors, the diagnosis of low back pain is not straightforward. While most low back pain is caused by muscular and joint problems, this cause must be separate from neurological problems, spinal tumors, fracture of the spine, and infections, among others. Management. Management of low back pain depends on which of the 3 general categories is the cause: mechanical problems, non-mechanical problems, and referred pain. For acute pain that is causing only mild to moderate problems, the goals are to restore normal function, return in the individual to work, and minimize pain. Prevention. Effective methods to prevent low back pain have not been well developed. Exercise is probably effective in preventing recurrence in those with pain that has lasted more than 6 weeks. Medium firm mattresses are more beneficial for chronic pain than firm mattresses. Prognosis. Overall, the outcome for acute low pain is positive. Pain and disability usually improve a great deal in the first 6 weeks, with complete recovery reported by 40 to 90%. In those who still have symptoms after 6 weeks, improvements in general is slower, with only small gains up to 1 year. At 1 year, pain and disability levels are low to minimal in most people. Distress, previous low back pain, and job satisfaction are predictors of long-term outcome after an episode of acute pain. Epidemiology. Low back pain that lasts at least 1 day and limits activity is a common complaint. Globally, about 40% of people have lower back pain at some points in their lives, with estimated as 80% of people in developing world. Approximately 9 to 12 of people have lower back pain at any given point in time, and nearly 1/4 report having it at some point over any 1 month period.